second group of Cuban doctors has arrived in Turin, Italy. They arrived Monday morning at the Turin Castle Airport to collaborate in the fight against COVID-19. The latest team of Henry Reeve medical specialists was greeted by the city's mayor and other authorities. The first medical brigade from Cuba arrived back on March 22nd and worked at an emergency field hospital, which was inaugurated on the 24th in Crema, Lombardy, to support local hospitals which had been over capacity. The Prime Minister of Barbados and the chairperson of the Caribbean community, Mia Mottley, announced that there will be a meeting by the heads of government of the region.
I'll advise the country that there will be a special heads of government meeting. I've written to my colleague heads and asked that we meet on Wednesday, April 15th, so that we can share ideas, share experiences first and foremost, but also look and see whether this is not the moment where CARICOM's true promise is upon us. That the notion of a single domestic space, that the notion of a single market, and what therefore are those things that we need to do in order truly to allow our sovereign boundaries to have a virtual reality that is the CARICOM entity, the Caribbean community, while the legal sovereign boundaries remain what we know. And what do I mean by that? That we probably will have to have a common public health protocol and common border policy. But what it does is that it expands the market of persons who then can help sustain each other far wider than it was at the beginning of this address, just as other heads have had to do. I'm speaking to you not just about saving lives, but also sustaining livelihoods.
And Prime Minister Mottley also praised the efforts of frontline workers in the fight against the coronavirus.
My friends, I want to salute publicly the doctors, the nurses, the orderlies, the lab technicians, the Dos Santos lab, which is proven to be one of excellent resource for us, such that other people who are having to rely and to send out tests to Carrefour, we're able to do it here.
The government of Mexico City is working to aid homeless citizens during the pandemic. Brigades of workers wearing protective equipment are taking to the streets to convince the city's 2,000 to 4,000 homeless people to go to shelters, which are being expanded. Besides this, workers are also delivering packages of medical supply like thermometers, face masks, and paracetamol to people who have called in to government hotlines reporting symptoms of COVID-19. Authorities of the city of 21 million people are recommending people with non-urgent symptoms to isolate at home so as to not overwhelm the health system. In the Democratic Republic of Congo, cities are being disinfected to curb the spread of the novel coronavirus. In Kinshasa, firefighters have been disinfecting public spaces, taking advantage of the lockdown imposed by the government. For 10 days, the Fire Brigade and the Ministry of Health will disinfect close to 3,000 hectares, hoping to slow down the rate of infection. According to the World Health Organization, the DRC has confirmed 223 cases of COVID-19 with 20 deaths.
At the moment, we are decontaminating the city of Kinshasa during this period of confinement of the commune of Gombe. The goal is to decontaminate secretions, dirt, and where people touch. People touching can contaminate places, buildings entrances. They can spit here and there. That's why we're doing this, to try to minimize the impact of COVID-19.
Vocational school teachers in Turkey have joined the fight against COVID-19. 3 public schools in Istanbul have been recruited to produce 15,000 protective face masks a day. Those are compulsory in public spaces such as supermarkets and public transport and are being distributed free of charge by the government. Turkey has reported over 50,000 cases of the novel coronavirus and over 1,000 deaths.
We are producing and distributing these masks free of charge for the people of Istanbul, especially for those who have to use public transport or those who are disadvantaged and cannot easily acquire the masks.
And the COVID-19 pandemic in the United States has disproportionately affected minority groups and those who live under fragile economic conditions. The Latino community in New York City accounts for 34% of deaths caused by the novel coronavirus, as members of the community often lack access to proper health care. Many are also struggling with the downturn in the economy, having lost their jobs, which often require them to leave home. But all across the U.S., minorities have been the first ones to bear the brunt of the crisis, as African Americans are also falling victim to the virus in large numbers. Many report discrimination in medical care and a history of chronic illnesses linked to structural racism that can lead to more serious forms of COVID-19. Experts point out that as such, the pandemic has exacerbated many of the social issues endemic to an unequal society.
I was working on construction, but because of this, the work was stopped because of the coronavirus. We can't be like this together because you never know who has the virus.
This will last until the month of July, so I don't know what to do. I survive because of the organization that gives us food.
We have more stories coming up. Don't go away. Welcome back. Venezuela will extend the state of alarm decreed on March 13th for a further 30 days in response to the coronavirus pandemic, a decision that involves prolonging a national quarantine to combat the virus, which has so far left at least 9 people dead and 175 people infected.
Today, President Nicolás Maduro has decided to extend the state of alarm for another 30 days. Within the framework of the states of exception contemplated in the Constitution of the Republic. Tomorrow, this state of alarm will be duly published in the Gazette as one of the measures to continue controlling and preventing COVID-19. We are in an important battle. We have always spoken with the truth, and today Venezuela can say its curve, it's flattened.
On Saturday, Venezuelan Communications Minister Jorge Rodriguez announced that no new COVID-19 cases were reported during the previous 24 hours.
We want to announce with all responsibility that in the last 24 hours, no new COVID-19 cases have been reported. We want to announce that we are doing an approximated of 25,000 COVID-19 tests per day and every day. President Nicolás Maduro asked us to announce the information to the people.
During his Easter message, Pope Francis called for an immediate ceasefire in all countries at war and urged European nations to show solidarity in the face of a coronavirus pandemic.
This is not a time for division. May Christ or peace enlighten all who have responsibility in conflicts, that they may have the courage to support the appeal for an immediate global ceasefire in all corners of the world.
The Pope also called for an end to sanctions imposed on various countries in order to enable them to adequately respond to the coronavirus pandemic.
In light of the present circumstances, may international sanctions be relaxed, since this makes it difficult for countries on which they have been imposed to provide adequate support to their citizens, and may all nations be put in a position to meet the greatest needs of the movement through the reduction, if not the forgiveness of the debt burdening the balance sheets of the poorest nations.
The Pan American Health Organization in Jamaica has donated personal protective equipment to frontline workers in the fight against COVID-19. The organization's representative for Jamaica, Cayman Islands, and Bermuda said the donation was made to safeguard the lives of health workers as they continue to take care of coronavirus patients. The World Health Organization has expressed concern over the high number of frontline health workers who have been infected with COVID-19. The Prime Minister of St. Vincent and the Grenadines, Ralph Gonsalves, has exalted the Venezuelan government for helping Caribbean countries with resources to combat the COVID-19 pandemic, despite having its own challenges.
I want us to get this. Venezuela is in a very difficult economic position. Venezuela is in a political situation with threats to its independence and sovereignty, where there are forces in our hemisphere threatening regime change and seeking to undermine lawful authority in Venezuela, creating the circumstances of facilitating a condition for social and political unrest. Venezuela has its own challenges with COVID-19. They have been able to acquire a certain number of the rapid tests, these kits, and also the reagents. And instead of keeping all for themselves, they are sharing with us and Dominica and Grenada and Antigua and Barbuda. I think this is wonderful.
In the midst of the pandemic, the Uruguayan government has refused to provide a basic income for the most vulnerable sectors of the population or raise taxes on big businesses to tackle the health crisis. More details in this report.
Uruguayan President Luis Lacalle Pou ruled out the possibility that society's wealthiest sector make a greater contribution to the state in order to combat the COVID-19 pandemic. Questions as to whether the economic crisis merited higher income tax for the richest, Lacalle answered as follows.
Today, taxing the capital, from my point of view, is to impute the possibility of those who are going to make force at the exit of the crisis. That's why we won't do it.
This decision reveals the lack of coherence with which the government is facing the situation. Days ago, the president himself announced a transitional tax on public sector salaries over $2,700 in order to combat the crisis. But he said nothing about taxes on the private sector or big businesses. It must also be added that he refused to guarantee a basic income as proposed by several social organizations.
It is not the universal basic income. It is a transitional income in the emergency that allows to solve staying at home, because the work became small, because there are less people on the street, because there is less money circulating, and there are sectors of private activity with important incomes. And it could be a good thing to study about what way they could contribute so that we could arrive to a financing that reaches out a helping hand for these people.
With no possibility of the private sector or big business contributing more to state revenue, it is clear that the crisis will be paid for by workers. According to Doctor in Political Sciences Constanza Moreira, the government has already decided that solidarity should only come from the state, while the private sector will not have to contribute a single cent.
In reality, we are working our way out of the crisis using state resources, because the debt is paid by everybody, because pensions, because the salaries that are taxed are those of public officials, because pensions are paid for by society as a whole. Evidently, the part of the society that is called on to be solidary is the state. It is basically the state, because the private sector remains untouched, as does big business.
The COVID-19 pandemic has already caused multiple economic impacts in Uruguay. Since the health emergency was decreed, as well as the voluntary isolation of citizens, the labor market has contracted, and more than 120,000 people have requested unemployment insurance. More than 300,000 informal workers have been left without an income, and the future points towards an economic recession. Faced with the dramatic situation, there are some who bear the brunt of the crisis, while others only seek to protect their profit. Mateo Grillet, Telesur, Montevideo, Uruguay.
Thank you for joining us again. There are now over 13,000 COVID-19 cases recorded in Africa. According to the Johns Hopkins University and the Africa Center for Disease Control, 13,636 cases have been confirmed on the continent, with 742 people dead. Only 2 countries are still free from the virus, Lesotho and the Comoros Islands. Meanwhile, the chairperson of the African Union and President of South Africa, Cyril Ramaphosa, has appointed a special envoys to mobilize international economic support for the continental fight against COVID-19. The special envoys will be responsible for soliciting rapid support as pledged by the G20, the European Union, and other international financial institutions. The first person to contract Ebola in the Democratic Republic of Congo in more than 50 days has died, and in hopes that the second worst outbreak of the disease in history might be over. The country planned to declare an end to the epidemic on Monday, which would have allowed its overstretched health service to concentrate on containing the virus, which has infected 215 and killed 20 people. The new Ebola case, the first since February 17th, was a 26-year-old man in the area of Beni, a town in eastern Congo. He developed symptoms on March 27th and died in the hospital on Thursday morning.
We were about to declare the end of Ebola on Monday, but that is normal. It can happen. That's how we put a 42-day window. That's twice the incubation period to make sure that no chain of transmission has been forgotten.
China has reported the largest number of new coronavirus cases in 6 weeks. The Chinese Health Ministry announced 108 new confirmed cases, of which 98 were imported. The new surge in number of cases is the largest to be recorded since early March. China has 867 new confirmed cases imported from abroad, including 38 severe ones. Spain has started easing lockdown measures as the COVID-19 starts to show signs of slowing down. Businesses have started slowly to reopen in the capital, Madrid. The country's health ministry announced that the number of people dying from the COVID-19 has further fallen, 517. Spain also recorded the lowest number of new daily infections ever recorded since March 20th.
There is a lot of people who are going back to work today after this paid leave, and on their return, they are going to meet the civil guards who are trying to ensure their safety, and moreover, who are helping to distribute the appropriate protective materials as they try to get to work. I can tell you that so far, the day is passing with complete normality.
Iran's President Hassan Rouhani says the country has won a legal victory over $1.6 billion of its assets that had long been frozen in Luxembourg at the request of the U.S. government.
Our central bank, our foreign ministry, all our dear colleagues have also recently achieved a very good victory in a legal battle. $1.6 billion of our money was in Luxembourg, and the Americans had put their hands on it and confiscated it. And we were going through cases, trying for months. Praise be to God, we succeeded some days ago and freed this money from the Americans' grasp.
Sri Lanka's Catholic Church says it has forgiven the suicide bombers behind the attacks that killed hundreds of people last Easter. Cardinal Malcolm Ranjit said during an Easter Mass broadcast from a TV studio due to the coronavirus that they offered love to the enemies who tried to destroy them. The bombers targeted 3 churches and 3 luxury hotels, killing at least 279 people and wounding 593. And during the weekend, April 11th marked 18 years since the coup d'etat against the government of President Hugo Chavez. So let's recall what happened on that day.
The social policies implemented by Commander Hugo Chavez were rejected by Venezuela's opposition, who orchestrated a coup d'etat against Hugo Chavez. As part of the coup d'etat on April 11, 2002, Venezuelan opposition called on their supporters to head to the Miraflores Palace, where supporters of Hugo Chavez had already gathered. The protest became violent when snipers positioned on top of buildings shot and killed both ruling and opposition supporters. On April 12, the Bolivarian leader was kidnapped by military insurgents who threatened to bomb the palace. The Venezuelan media outlets, through fake news, played an important role in this coup d'etat. After the coup was carried out, businessman Pedro Carmona Estanga self-proclaimed as president of Venezuela, But people did not agree with that and demanded that the coup plotters return constitutional president Hugo Chavez. Forces loyal to Hugo Chavez restored constitutional order in the country, while the coup leaders escaped. Government officials took to the palace along with Vice President Diosdado Cabello, who was sworn in by the National Assemblies as temporary president. He gave the order to go and rescue Commander Chavez. Finally, on the dawn of April 13, 2002, the revolutionary leader was rescued by military members loyal to his government. The Bolivarian people welcomed Commander Chavez, who once again regained constitutional power. This date marked and strengthened the Bolivarian Revolution, remembered as a civic military union that regained social and political order in the country.
And with that, we end our news brief, but you can find these and more stories by checking our website, telesurenglish.net. And be sure to also follow us on social media. We're on Facebook, Twitter, and Instagram. For Telesur English, I'm Carla Gonzalez. Thank you for watching.